Grandma, and so since you've asked me like my input, I'm going to tell you a little bit that I've learned about the skeletal system, osteoarthritis, her broken hip, her treatment, how it will affect her living, the recovery process, her long-term care, and what I think we should do about Grandma's hip. And so the first thing I was going to tell you about is the skeletal system, and the skeletal system is really important. It performs all of the functions of the body, such as support, movement, protection, blood cell production, calcium storage, and endocrine regulation. It enables us to move throughout our daily lives. And the adult human skeletal system consists of 206 bones, as well as tendons, ligaments, and cartilage that connect them all. The hip is a projection of the pelvis and upper thigh bone on each side of the bodies. The hip joint allows us to walk, run, jump. It bears our body's weight and the force of the strong muscles of the hip and leg. The hip joint is like a ball and a socket synovial joint formed between the oscata hip bone and the femur. And so do you have any questions for me?
What is osteoarthritis?
Osteoarthritis is the degeneration arthritis, which is like inflammation of the joint, and it's when the cartilage wears down over like a period of time. And so it is important to keep Grandma active so that it doesn't get worse, and to reduce swelling and pain, which is where like physical therapy will come in, which I'll tell you about later. And then osteoarthritis has 3 characteristics. Bony growths develop around and the edge of the joints. It damages the cartilage, and synovitis, which is mild inflammation of tissues around the joints. So under Grandma's, here's what osteoarthritis looks. Here's like regular bones, but see if you can see the breakdown. This is osteoporosis, so it's just the bones, but this is what the joint will look like. It would look regular like this, and then it would break down more. And so this is what her joint, like it's been breaking down with the osteoarthritis, which does not help that she broke her hip. So because Grandma broke her hip, Grandma already has osteoarthritis. It'll be important for her to use her joints while in recovery. This is to keep them like loose, because if you don't use your joints a lot and you have osteoarthritis, they'll get really inflamed and they'll hurt even more. And because she has osteoarthritis, she does have a higher risk of breaking her hip, which is probably why it broke this time that she fell. So the treatment that would happen would be, it often involves a combination of surgery, rehabilitation, and medication. The medication is mostly to control the pain, and the therapy is all the stuff that will help her hip move the way it's supposed to do. I would be concerned with, hold on, I can't read that. But, so here are some physical therapy stretches that they'll help her with. And all of these, like the sitting on the wall sits, and all like the turning over, and like all of these are, if you have a hip surgery, this is what will be great for it. And so it's really important that she does these surgeries. And yeah, so after her surgery, and so what her surgery is, her surgery entails, I'm going to read what the doctor wrote that the surgery will be. So the surgery entails the surgeons inserting metal screws into the bone to hold it together while it heals. Another option would be to insert a rod into the marrow part of the thigh bone. A screw then passes through the upper part of the ball, through the femoral neck, and into the ball portion of the hip joint, which, as with all surgery, pain will be a factor, and so we'll need to keep her on pain medication, and the rehabilitation will take effect, because then she'll have less pain, you know. And so this will obviously affect her living a lot, and so any injury to an older person will have much more effect than it would on like you and me, because we're younger. And so it'll cause them to have to live a little differently, and this could be either going to a home or anything like that, but we don't want her injury to worsen. Like, that's our biggest fear, is having the injury worsen. So she needs to be as careful as possible. And so after her surgery, therapy will be necessary for a full recovery. And so So her recovery process is really important, because after surgery, you know, there's all those guidelines that you have to follow. It's just as important for elderly hip procedures. And because of her osteoarthritis, her recovery process will be significantly more important. Along with physical therapy, Grandma will also need to work on regaining her muscle in her hip area so that she is stronger and won't fall and won't cause more damage to it. And so recovery will probably take about 6 months, but could be longer because of her osteoarthritis. And she will most likely be moved to a rehab center where when she is deemed ambulatory, we'll make that decision onto whether she should go home or whether look for an assisted living that she can live in. So on to long-term care, which is probably what Grandma is most worried about because she has been living at home by herself for so long. And we do have two options for this long-term care now. She can either move into an assisted living or hire a home health nurse to come in, as well as a physical therapist. Now, the cost-wise on average to have a daily health aide come in and fix your meals and along with the physical therapist, it'll cost about $7,124 a month. But including Grandma's home bills, so like everything she has to pay for her house as well. And so to live in an assisted living, she would have her own little apartment. She would get to meet a lot of people. She would make friends. She would have physical therapy every day, and she'd get 3 square meals with all of her nutrition. That'll be about $3,500, but insurance will cover most of it. And then she wouldn't have to strain herself with making meals, like I said, so that's good. And then she would receive therapy, which, again, will help her osteoarthritis because she won't be as in much pain and the inflammation won't be there. And so there are many social opportunities. So since Grandpa died, I know Grandma's been kind of lonely, so it would be important for her, like, our social lives are also really important as well as our, like, physical lives. So if she gets to, like, doing activities and making friends, like, she could be better off as well. Personally, I think that Grandma should go to an assisted living because Grandma's a social person. Like, Grandma's so good at bingo. Like, she would love an assisted living place. And so she would make so many new friends, and it would just be so much better for her to live in an assisted living place. And so that's what I think about Grandma's hip. And if you have any more questions, just, like, let me know. Okay, love you. Bye.